Warning signs of hormonal imbalance in women? Well, before asking that question, you've got to specify what hormone, because trust me, there are a lot of them. But if you're asking that question, I'm willing to bet you're concerned with the warning signs of hyperandrogenism or high testosterone. Elevated androgens signal to the oil gland to make more oil, more sebum, and that leads to more stubborn acne. In adult women, acne like this is often on the jawline, although not always. A lot of people will refer to acne on the jawline and chin as hormonal acne, but all acne is influenced by androgen hormones. And as a side note, many women who have disorders of hyperandrogenism do not have acne exclusively on the jawline and chin. Facial skin overall will be oilier due to the increased activity at the sebaceous gland, and you might deal with issues around seborrhea like seborrheic dermatitis, tinea versicolor. High levels of androgens can result in miniaturization of the hair follicles on your scalp and pattern hair loss with a widening of the central part. In contrast to hair loss on the scalp, you can experience unwanted hair growth on the face, the chin, the neck, the chest, around the nipples, and the stomach and upper thighs. This is known as hirsutism. As a side note, many women have some degree of terminal hair growth on their face, and it isn't always necessarily hormonally related. It could just be your genetics. Why do you have hyperandrogenism? Maybe it's PCOS, an endocrine disorder. Also could be related to a tumor of the ovary, the pituitary, or the adrenal gland. Or maybe you have hyperandrogenism as a result of a medication you're taking, or maybe you are abusing anabolic steroids for muscle building purposes. These are some possible side effects. You also can have hyperandrogenism as it relates to having obesity because the excess body fat tissue does make androgen hormones. It's also not uncommon to have overlap with this as well as other hormonal disorders, metabolic issues like insulin resistance, diabetes. If you're concerned that you have a hormonal abnormality, see your healthcare provider, not some TikTok guru on here trying to sell you a bunch of supplements. And hormone balancing teas, yeah, that ain't gonna do it.